Welcome to another session of Understanding Human Anatomy. In this video, I wanted to discuss the muscles of the arm. So these are the muscles that we find surrounding the humerus. I'm going to start by drawing a cross section through the arm, somewhere about the middle of the humerus, maybe a little bit inferior to that. And I want to put the humerus here in the center of our drawing. First, we're going to find that there is deep fascia, just deep to the superficial fascia and skin. And I'm going to draw that in a purple color. Just under the skin. Around like so. Now, deep fascia is a fascia that's used to wall off an area, to divide. And superficial fascia is a very loose kind of connective tissue. The fibers are separated by lots of space, and we find lots of fat in it as well. So superficial fascia contains a lot of fat, and it's a very loose type of tissue. The deep fascia has no fat in it. The fibers of the connective tissue, the collagen fibers, are very dense, packed very tightly together. And deep fascia does wall off. And we're going to find that there is also deep fascia dividing the arm into two compartments. It will begin with the fascia, the deep fascia just under the skin, and go over to the humerus. Then on the other side, we'll begin with the humerus and go over to the skin. Now, what this does is divide the arm into two compartments, an anterior compartment and a posterior compartment. So we put some labels here. Anterior, which would make this side posterior. And so these two compartments, one on the anterior side of the arm and the other one on the posterior side, are going to be named the anterior and posterior compartments. And we'll start with the anterior compartment. And the first thing we're going to do is create a rule. And that rule very simply says that anterior compartment muscles are all flexors. Now that doesn't mean that they only flex or they flex the same joint, but they're all flexors. If we take a look at the muscle, we'll see that in the anterior compartment at this level, we see two muscles. There's really three in the anterior compartment. But the third one would be at a higher level, the superior. The one we're talking about here. And you can see one of these muscles is more superficial. And that muscle is biceps brachii. So biceps brachii is the muscle that's a little bit more superficial. The name literally means two heads. And the muscle does have two heads. And I'll try and indicate that a little bit here by drawing a divider down like so. These two heads merge into a single muscle as they approach their insertion. And both heads take origin from the scapula. The long head of the biceps brachii originates from just above the glenoid fossa, and it originates as a round tendon that then passes over the top of the humerus and into the intertubercular groove and runs down into the intertubercular groove, exiting the groove and then expanding into a fleshy muscle. The short head of the biceps takes origin from the coracoid process of the scapula. And these two heads, as I said, merge, form a common tendon, and that tendon inserts on the radial tuberosity, the tuberosity on the anterior surface of the radius. Now this is important because biceps brachii will supinate the forearm if it is already pronated. When it pulls on that radial tuberosity, it will pull it around to the front, which will cause the hand to supinate. Once it supinates, then it can flex. So it's a strong flexor of the elbow, but only when the hand is in the supine position. And you can check that out by just flexing your bicep on one side, feel the muscle with your other hand, and then pronate the hand that you're on the side that you're flexing, and you'll see that the bulge of the muscle goes completely flat. So biceps brachii. And again, it takes origin from the scapula and it inserts on the radius. So this bone does not attach to the humerus at all. It spans the humerus. The deeper muscle is one called brachialis. Brachialis is a muscle that originates from the humerus, from about the distal half of the humerus, and then runs anterior to the elbow joint and inserts on the ulna, just inferior to the trochlear notch. It's actually a place called the tuberosity of the ulna, but it's not much of a tuberosity. Brachialis can only do one thing, and that is to flex the elbow joint. So biceps brachii and brachialis are synergists in flexion of the elbow. There is one other muscle of the anterior compartment that we can't see because it's higher up, and that is the Coracobrachialis. Coracobrachialis also in the anterior compartment. It's a flexor, but it's a flexor of the shoulder joint. And the coracobrachialis takes origin from the coracoid process of the scapula and inserts about the middle of the humerus, on the shaft of the humerus. So, three muscles in the anterior compartment: biceps brachii, brachialis, and coracobrachialis. Then the posterior compartment. The posterior compartment are all extensors. They act to extend joints. And the posterior compartment of the arm has only one muscle in it, and that is biceps brachii. And that is triceps brachii. And let me sketch triceps in for you. it will essentially occupy the whole posterior compartment. The name triceps means three-headed muscle, so it's as if three muscles combined together. So you have three different origins, and then they come together on a common tendon for insertion. Triceps brachii, filling that posterior compartment like so. Let me draw a line to it. There, this is the triceps brachii. One of the heads originates from the scapula, from the surface inferior to the glenoid. Then the other two heads originate from the humerus. The three heads come together, form a common tendon that inserts on the olecranon process of the ulna. So the triceps extend the elbow joint, or extend the ulna. So, anterior compartment, the rule is that they're all flexors: biceps brachii, brachialis, coracobrachialis. Posterior compartment are extensors, and we only have one muscle to worry about, triceps brachii. The compartments will continue down into the forearm, and we're going to find that, with a couple of exceptions, anterior compartment muscles will be flexors and posterior compartment muscles will be extensors. So it carries over. And the next video will deal with muscles of the forearm. Thank you for your attention.